Paging Dr. Paul, and today we are discussing a common concern for parents, fever in children. So we are paging Dr. Paul to find out how to evaluate a child's fever and to understand how to treat it.
Yeah.
Good morning to you, Dr.
Good morning.
Paul.
Good morning, Rosie.
Good morning to you. Okay, so can we just ask this?
Yeah.
What temperature is considered, child's got a fever?
Well, depending where you take it, either orally or rectally, but I consider anything over 38 degrees.
Okay.
Normal is 37, let's put it this way.
Okay.
37,
Okay.
37.5. So anything over 38 degrees, to me, is a fever. But I must qualify that, Rosie, because the fever is not the only thing that you're looking at. You can have a child that has a higher fever, but is very well, looks well. It doesn't work. That looks very well. And so so the number is important, but it's not the only thing we need to be looking at. I've got children that had very high fever running around the hallway, other
right.
children who are sicker. So that's the thing you need to be looking at.
What causes a fever?
Good question. It's a body's reaction to likely something outside. So a virus or a germ coming into the body, and it's the body's reaction trying to fight it off, actually. So it gives us a sign. So when we're worried about fever, we're not really worried about the fever itself. We're worried about, what's causing the fever, right?
Right.
That's the most important thing.
What
virus is
causing?
it? Is it a bacteria? Do we need to give antibiotics or those type of things?
You mentioned right off the top, you said that you can take a child's temperature orally or rectally.
Yes.
Which is better?
Well, for children 5 and below, it's rectally, because orally they have to be able to hold the thermometer in their mouth, right? So anybody
Yes,
over
of
5
course.
years of age. Now, some people do it in the armpit. It's not an accurate way of doing
Okay.
it. So younger children rectally, any child over 5 years of age by mouth.
Okay, so what fever medications are out there
Yeah.
for children?
Okay, first of all, we do not use aspirin. I say that at the top of the hour. So aspirin, ASA is not used. We have Tylenol, which is acetaminophen, or ibuprofen, which is Motrin. Those are the two things that are given. They should be given every 4 to 6 hours based on the recommendations on the package. The other thing, too, is parents ask me, my child has an ear infection, and they gave my child antibiotics. The antibiotics take about 24, 48 hours to kick in, and they ask, well, can I give my child fever medications although he or she is taking antibiotics? And the answer is yes for the first day or so.
Is there a way to treat a fever without medication?
Yeah, there is. There's basically what you want to do, again, presuming the child is well otherwise, is feeding and drinking well, and is older. That's younger children, less than 6 months of age, we worry more about. But the very thing, simple things that you can do is don't overdress the child.
Okay.
And lukewarm, sponge baths are very good. No alcohol rubs or anything like that, because I know a lot of people talk about that. So basically, lukewarm sponge baths keep the baby comfortable.
When should you call your doctor and go, whoa, this is really scary, I'm nervous? When do you do that?
First of all, for younger children less than 6 months of age, you should be calling your doctor for any sign of a fever.
Okay.
Particularly less than 3. Less than 3 months of age, I'm really worried about fever in children. In older children, if the fever persists more than 3 or 4 days, or if the fever is very high, over 39.5. And for that matter, Rosie, again, I can't stress enough, even if it's low fever and the baby is not, or the child is not behaving normally, not feeding well, having difficulty breathing, it's not just a fever that will trigger you to get medical attention.
That's a telltale sign when they're not behaving normally.
Exactly. That's
Okay.
so it's the combination of the fever, other symptoms, and not behaving normally, not able to sleep, not able to drink, not able to feed, not able to breathe properly.
What if you don't have a doctor, if you don't have a family
Well,
doctor?
if it's an emergency, you need to go, unfortunately, you need to go to the emergency room, or if there's a walk-in clinic.
Dr. Paul, always such a pleasure to have you on the show. We always learn something new. Thank you very much for your
Thank
time
you,
this
Rosie.
morning. Thank you so much.